Well, a good Friday afternoon to you. I'm Dr. Steve G. Jones. I'm a clinical hypnotherapist, and today I'm going to talk with you about deepenings. Now, deepenings, that would be the second part of a 5-part hypnotherapy session. The first part that we've already talked about would be inductions. That's where you're inducing the hypnotic trance. The second part that we'll talk about today, that's deepenings, where you're intensifying the induction. So you've induced someone into hypnosis. You've taken someone from not being in hypnosis at all, and you've induced them into hypnosis using the induction. And today we're going to talk about the deepening, where we're deepening that, as the name implies. We're intensifying the induction so that we can have them deeper into hypnosis. And then after that will come part 3, which is the script, and then amnesia, where we're having them forget consciously the programming we've done subconsciously so they don't unravel it, and then trance termination. So this is the second part of a 5-part hypnotherapy session the way I teach it. Let's go ahead and take a few moments and check in and see who we have here. Hello, Ida. Hello, Priya. Hello, Sabrina. Zilia, hello to you. Norma, hello to you. Miss Rowley, hello to you. Usama, hello to you. Teresa, all right, hello to you. And Miss Rowley, hello to you. Susie, hello. Iwa, hello. Annie, hello. May, hello. People from all over the world joining in. Wonderful to see people. Wonderful to see the live stream filling up with so many people interested in hypnotherapy, learning how to take care of yourself, learning about your subconscious mind and the power that you have. Miss Cortez, hello. Brenda, hello. Stephanie, hello. Jane, hello. Lots of people joining in, and today, as I've said, we're going to talk about deepenings. A deepening is where you're intensifying the induction that you've already done. Tamara, hello. Keith, hello. Liana, hello. Janice, hello to you. Yasmin, hello. And I will be talking a little bit about deepenings, telling you what they are and how to use them, and then I will open to discussion and questions and answer any questions that you may have about deepenings. And hello, Yasmin from Germany. Okay, let's go ahead and get started. All right, so in a deepening, what we're doing is intensifying, as I've said, the hypnosis. So we've got someone in hypnosis thanks to the induction, and now we're going to put them into a deeper state of hypnosis. And we're going to do that by using a very straightforward technique, which is simply called a deepening. So it's very straightforward, as the name implies, and let's go ahead and jump into it. So now remember, we've already done the induction. We've already induced hypnosis. We've already got the person, the patient, the client. Sometimes we may refer to them as the subject, although that's a little informal. And we've got them from being wide awake in full awakening consciousness, which, by the way, we refer to as beta, wide awake, full awakening consciousness. We've slowed them down into at least alpha. Now remember the stages of consciousness. We have beta, that's wide awake. We have alpha, that's slowed down just a little bit. And then below that we have theta, and then delta. So if we've got someone into alpha, which is the lightest state of hypnosis, we're all set. Now, interestingly enough, you can be in alpha without even realizing it. When you ride a bike, when you watch TV, when you read a book, when you take a shower, when you're vacuuming, when you're just waking up or just going to sleep, anytime you're doing something that doesn't require you to be wide awake, anything you know how to do, those things I just mentioned, you know how to do them. And so you can go into a state of hypnosis called alpha. And alpha is very easy to go into. So we don't have to be completely out of it. We don't have to forget everything that happens necessarily. We don't have to feel like we're in some kind of zombie trance or anything like that. You go into alpha in and out of alpha all day long. Anytime you do any of those activities, like riding a bike, watching TV, driving, if you know the way to go, like you're driving to work, for example, or to a friend's house, someplace that you go to regularly, you know how to do that. You don't have to pay strict attention to what's going on. Yes, if something were to happen while you're driving, you would become aware of it and you could act, but for the most part, your brain is powered down because it doesn't have to be fully aware because it knows how to do it. Now, it doesn't mean that you're not able to respond if someone jumps out on the road. Of course, you're able to respond, but what I mean is your brain doesn't have to learn things as if it's a new environment. When you're in a new environment, your brain is on high alert. You're in beta, you're wide awake, fully aware of what's going on, taking in information because this is a new situation. Let's say it's your first day in school. Yes, I had a good question like daydreaming. Yes, absolutely. Daydreaming is an example of alpha, but you can be in alpha doing things where you think you're wide awake and paying attention, such as driving or watching TV or reading a book, sometimes in a lecture. So let's compare your first day of school. Remember back your first day of school? It could be any school experience, high school, college, your first day of kindergarten even. You walk in and you're thinking, what is this? Who are these people? Where should I sit? What's going on here? Who's the teacher? Who's in charge around here? What are we going to learn? And so you're on heightened alert. You're in beta, full awakening consciousness. Now let's move you forward a little bit in the semester or the trimester or whatever kind of program you're in. You're a few weeks in and you're sitting there in the class and the teacher is droning on about whatever they're talking about and you're just kind of hanging out. You're there, you're paying attention, but you're not on high alert, so you've slowed down to alpha. The great news about alpha is, although you may be bored when you're watching that, is that your brain is actually more open to suggestion. So you're actually in hypnosis at that point. First day of class, not in hypnosis. You're wide awake in beta, full awakening consciousness. Your brain is taking in the environment, figuring out what's going on, how you fit in, where you should be, etc. Looking around, gathering data because it's a new environment. After a while, after a few weeks, you've slowed down to alpha because you know what's going to go on. You know that Susie sits here and Joe sits there and Bill sits there and I sit here and the teacher talks and I listen for an hour and I take notes. I pretend to be paying attention, whatever your learning style may be. You're getting through it. Or perhaps it's a special day where they've got a guest speaker in, or it's something particularly interesting to you and you do go to beta, full awakening consciousness. But for the most part, students tend to hang out in alpha. So in alpha, you are very suggestible. And alpha is our goal during the induction. We've got someone into alpha, the lightest state of hypnosis. So when you're listening to a hypnosis recording or going to a hypnotherapist, don't expect to be in a completely out of it state where you're like a zombie and you don't know what's going on, and whatever conceptions you may have about hypnosis, let those go, because you can be in hypnosis without even realizing it. So we've got someone in alpha. We've got someone in the lightest state of hypnosis. Maybe they've gone deeper, and that's fine. It's not necessary, but it's fine if they've gone down to theta or delta, the deeper states of hypnosis. But in the deepening, we want to intensify whatever we've done. So we've got them into hypnosis at some level. Now we want to intensify it. We want to get them deeper in hypnosis. So we use a deepening. Now, a deepening is very straightforward, just like an induction. Remember the induction, you're spending a few minutes with them, telling them that they're on a beach or walking in the woods, using all of the senses, sight, sound, smell, taste if that applies, smell if that applies. Usually smell applies, but taste doesn't. So on a beach, there you can smell the salty air. In the woods, you can smell nature. You can smell the trees or the dirt or the leaves or what have you. Usually there's nothing to taste when we're developing an induction and bringing them through this. Usually it doesn't apply. Sometimes it does, usually not. Maybe if they're on the beach, they're at a picnic and they're eating something, but usually we don't involve taste which is the gustatory sense. So we've involved sight, sound, feeling. What does it feel like to walk through the environment? How do they feel emotionally? They feel relaxed. How do they feel physiologically? Also, they feel relaxed. And perhaps the smell of what's going on, which is also relaxing them because it's putting them in that environment. We've done all that in the induction. Now I want to intensify that. So the way we're going to do that is by correlating three things. We want to correlate three things in the deepening. Now, if you take more of an interest in this, you can learn more about it at hypnosiscertified.com. You can check out hypnosiscertified.com if you really want to get into it. I'm just giving you a sample of it and teaching you a little bit about hypnosis so you'll understand it. And I'm going to answer your questions, most importantly, after this. So in the deepening, we're correlating three things. We are correlating downward motion, that's one thing, perhaps the setting of the sun, or perhaps we're going down some stairs, or perhaps if we've been walking in the woods, we're going to walk down a hill. So we've got downward motion, downward counting, and I like to count from 10 to 1. So as the sun is setting, I'm counting down 10. The sun is going lower, 9, etc., down, down, down. Or if they're walking down a hill, I'm counting them down the hill. Or if they're in a house in the induction, and I've involved all the sights and sounds and everything related to the house, then I'm going to have them perhaps walk down stairs in a house. And I'm going to tell them it's safe, you're relaxed, you know, there's of course nothing to fear. And then I'm going to have them walk down steps. And as I count the steps, they're going to walk down them. So we've got downward motion, which is the sun going down, or them going down a hill, or them going down stairs, or perhaps going down an elevator, or perhaps if in the induction they've sat by a lake, they've thrown a pebble in the lake, perhaps in the deepening, the pebble is going down to the bottom of the lake, and we can track that motion in the deepening. So we've got downward counting, downward motion, sun setting, I'm counting down as the sun sets, for example, and downward relaxation, the most important part. We're correlating all three of these things. And the way I set that up in the deepening is I say, as the sun, for example, begins to set, I'm going to count from 10 to 1. So I've got downward motion of the sun, downward counting, 10 to 1, and as the sun sets, I'm going to count deeper, and you're going to relax more deeply as I count. So I'm counting down then 10 to 1, and then my job becomes easy. All I have to do is count from 10 to 1 and describe the sun setting, or describe that pebble rocking back and forth on its way down to the bottom of the lake, for example, or them going down the hill and I'm counting them down the hill. So my job just becomes counting at that point and describing what happens. So that's the way that the deepening works. At this point, I see some questions have come in, but if you don't mind, if you do have a question about the deepenings, please go ahead and re-ask that at this time, and I'm going to answer that. Brenda has a question. What if the deepening doesn't work? Do you keep going with the session? That's a great question, Brenda, and we have to define doesn't work. So some hypnotherapists are, looking at the new hypnotherapist, they're looking at the client, they're attempting to assess how deep they think the client is. And in some schools of hypnosis, and I'm not saying this is right or wrong, I'm just saying that in some schools of hypnosis, they will teach assessment, how to assess how deep the client is. In my opinion, assessment kind of startles the client a little bit. Okay, now it's time to do a task. Now I'm going to be assessed and I have to move my arm a certain way or something like that. Here's my argument why I don't do assessments. First of all, it can bring the person a little bit out of hypnosis because you're having them do something or you're interacting with them some way and taking them out of the story, the nice story of the induction and the deepening. Secondly, does it really matter? Because by virtue of lying down and closing their eyes, they are at least in alpha. Remember, you go into alpha just by riding a bike, watching TV, driving. when you're just waking up, when you're just going to sleep, and you're taking a shower, when you're vacuuming, when you're doing anything by rote, when you're just sitting in a chair, closing your eyes, you go into alpha. So if all I need is for them to go into alpha, why would I spend time or be concerned or generate any kind of anxiety for myself about whether or not they're in alpha? So Brenda, when we say, your question, I'm going to read it again, Brenda, what if the deepening doesn't work? Do you keep going with the session? The deepening is going to work because by virtue of sitting down and closing their eyes, they are at least going to be an alpha, unless they are on some sort of drug, they've had too much coffee, or they're worried that something's on fire or something like that. Something's really got them at a heightened state, in which case you shouldn't be doing the hypnosis session anyway. So by virtue of just sitting down under normal circumstances and closing their eyes, they are at least in alpha, and we're just attempting to intensify that, or make sure they're really in a solid state of alpha that they will maintain while we're doing the script. So that's the answer to your question. Norma says, what programs can I buy for my 16-year-old daughter to help her with her confidence and her singing career? Okay, great question. So we'll take a little sidestep from talking about deepenings. Norma, you can go to hypnosisbysteveGjones.com, and we do have a confidence recording there. I'd recommend that, definitely. And Hassam says, does theta and delta state make you more suggestible than alpha? Hassam, that's a great question, and I have not seen any compelling research indicating that. Isn't that interesting? Some people spend a lot of time attempting to get the person into theta or delta, but as far as normal programming, I have yet to. Now, somebody knows a journaled scientific study that they can post here, feel free, but I'm not aware of any. If you do have any, please go ahead and post them. And I mean a study done by a university, done by PhD level psychologist or a psychiatrist. Let me know if you have any of those. But to the best of my understanding, Hassam, your question again, does theta and delta state make you more suggestible than alpha? To the best of my understanding, it does not matter. Now, it does matter when it comes to things such as helping someone not feel pain in hypnosis. In that case, I find the deeper the better. For example, if you're having someone go into hypnosis before dental surgery, they've elected not to have any painkillers, any kind of drugs whatsoever, and you are brought in by the dental surgeon and with their consent and with the patient's consent to put them into hypnosis, you need to have them in a deeper state at that point. But for normal suggestions like confidence, motivation, things like that, where you're not attempting to get them to not feel any pain, you do not need them in a deeper state. If anyone has any current research by a PhD psychologist or a psychiatrist, please feel free to post it here. And June says hello. And Shervin says, Dr. Steve, I get in alpha very easily, but I tend to stay long in alpha state in the morning. I am not a morning person, but I can't focus fully in the morning. How can I solve it? Okay, well, that's something that you should talk to your medical doctor about. Could be something as simple as having a cup of coffee. That's not advice. I'm just saying it could be something very simple. It could be getting more sleep. There could be so many things going on. It could be sleep apnea. I'm not saying that it is. I'm just saying that this is in the realm of possibilities. I have no way of knowing by the sentence that you typed what's going on with you. So Shervin, you need to talk to a medical doctor about that. Let's see. Michael says, I know that some Buddhist monks drink tea before meditation. Do you think this could help with the hypnosis as well? I do not think so. Anytime you have a routine, it's probably going to help. So I will say that as a caveat. For example, when I work with professional pitchers on professional, I've worked with pitchers on a professional baseball team, and you may notice that pitchers have a routine they go through. They swipe the pitcher's mound with their foot, they may move their hat. Sometimes they're signaling sometimes the pitcher is signaling to the catcher what's going on. They're signaling back and forth. But other times it's just a little routine that the pitcher goes through. And so I use those routines to anchor them to pitching success, so that they're anchored to the perfect pitch, whatever pitch they want to do in that moment. There are a lot of pitches available to a pitcher. So sometimes it's just signaling, sometimes it's just nervousness, other times it's what puts them in the zone. And so that's from the world of neuro-linguistic programming, which is based on Pavlovian research. You remember Pavlov with the dogs. So sometimes it's that. In some cases, when I've worked with pitchers, it's design, we develop something in particular. Maybe they'll swipe their hat from right to left, and that'll put them in the zone. It can be the same with the monks. Looking at it from the outside, you would say, tea has caffeine. It's not going to help you relax. In fact, it's going to stimulate you. However, if you're doing something consistently before meditation, such as tea, which is lower in caffeine than coffee, by the way, then it could help in that regard because it anchors you to be able to meditate. So 2 answers to that, Michael. Thank you for that question. And I would say the Buddhist monks have a good reason for doing what they do, because they are, after all, Buddhist monks, and they are known for being very, very good at meditation. Okay, Michelle says, I know this might be a strange question to ask, but I feel a little curious. If you happen to have taken a personal dislike to a person, can that stop you from hypnotizing that person effectively to that stage? Okay, so in Michelle's scenario, the way I understand it, you are hypnotizing someone who you don't like. That's interesting. Okay, so you're hypnotizing someone you don't like. Maybe it's a client you don't like because they're annoying or what have you. Therapists are people too. It happens. It is a realistic possibility. Of course, as a professional, you don't share that with them. You don't say, oh goodness, here we go again. No, you do your job, of course, because you're a professional. But if you don't like the person, it is possible, Michelle, it is possible. We now know about micro-expressions. Micro-expressions are very, very interesting. If you haven't seen the movie Ex Machina, very interesting. X is the first word, EX, Machina, M-A-C-H-I-N-A. It means from machines. And it's a throwback to something they used to do in plays. But the movie Ex Machina is about the development of AI, artificial intelligence, and what could happen, and it's very poignant and compelling, and it's very one day it's potentially possible. Essentially, some guy who owns a company kind of like Google develops robots, and the robot is able to read micro-expressions. Now that's real. Micro-expressions are real. They're little expressions that we do with our eyes and our mouth and our face that we don't consciously notice, but subconsciously we pick up on them. So in this movie, the robot was able to pick up on those in a human and was able to tell if the human was lying or not. So we pick up on those too. We're not usually consciously aware of them though, but we do pick up on them. So Michelle, to answer your question, your client will, at a subconscious level, probably know that you don't like them. Will it affect the session? I don't know. I doubt it. I doubt it will significantly affect it. I don't have any research on that. I don't like to say things that aren't research-based and that I don't have data to back me on. So I will not be able to give you a definite answer on that, Michelle. But my understanding of that is if there is an effect, it would be very minimal. It would be a very small effect. That's my educated guess. Sherman says, do you recommend listening to binary daytime backward recordings while doing other works? So these are recordings that I have specifically developed, my binary line of hypnosis recordings, which are not hypnosis at all. They're just suggestions. They're just positive suggestions for you. So binary recordings, or you hear the same suggestions in 2 different ears offset by 10 seconds. daytime recordings, or you just hear the suggestions straight. No hypnosis in any of these. Backward recordings are based on some research that shows there is some power in playing something backwards for somebody, that their subconscious mind can unscramble it. And the good thing about backward recordings is that consciously you're not aware of what's going on, kind of like micro expressions. You're going in below the radar. You're not triggering the person to consciously pay attention. And the benefit of that, of course, is they're not going to overanalyze it. So do I recommend listening to these recordings, these non-hypnosis recordings, by the way, while doing other things? Yes, that's what they're designed for. So you're further taking your conscious mind off of analyzing them by doing other things. Never listen to any hypnosis recordings of mine or anyone else while doing anything other than sitting or lying down. But those recordings are suggestions only. So it's kind of like having a good friend say, hey, you can do it, and you're very powerful and positive. Why not? I mean, why not have someone follow you around all day and say good things to you? Absolutely. So Joel says, good morning. And Norma says, you have challenges concentrating. All right, well, I do have a recording for concentration. Kathy says, after 10 minutes on your sleep hypnosis, I am relaxed and then I am out, which is absolutely fine. So the sleep hypnosis recording is designed to allow you to go to sleep. The benefit of a lot of my hypnosis recordings, and just hypnosis recordings and hypnosis sessions in general, is that they do help you get to sleep. Because hypnosis, the levels of hypnosis that we're talking about today, alpha being lightest, then theta and delta being lower, are the same as the stages of sleep. So you're going into hypnosis, you're going to sleep. So thank you, Kathy, for mentioning that. And I'm glad to hear that you go to sleep after 10 minutes of listening to my sleep hypnosis recording, because that's exactly what it's designed to do. And Michael says, thank you for your answer. You are very welcome. Christian says, how can you stop someone from being a control freak? Okay, well, anytime we get into now think about your question, Christian. You want to control someone to not control others. So you're attempting to control them. So anytime that we focus on controlling others, there's not a hypnosis recording for that. Even my recordings on confidence, which are designed to win over people and to win over large crowds. And we could even say control the situation by being so confident that you take charge of the situation. You're only really taking charge of yourself. So Christian, the only people we can ever really change and we should ever really focus on would be ourselves. So if you're having a challenge, Christian, with a controlling person, I recommend, if it's safe to do so, talk to them about that. Talk to them about how they're controlling, or perhaps separate yourself from that person. But with hypnosis, we don't spend a lot of time attempting to control others, especially attempting to control others who are controlling others, because then we just perpetuate this control type situation. But thank you for that question. Katarina says, hello from Germany. Lucine says, I wish you a great weekend. Thank you very much. Ida says, if I fall asleep after you count to 6, what state am I in and how long does it last? I'm trying to understand this. Okay, so we're back to talking about the deepening, which is today's subject. So in the deepening, I've said I correlate 3 things: downward motion, such as the downward motion of the sun setting, downward counting 10 to 1, and downward relaxation. So Ida's question is, what if I fall asleep? What if she falls asleep after I count to 6? So I've counted 10, 9, 8, 7, 6, bam, Ida is out. What state am I in? Well, if you're falling asleep, you're in theta or delta. So I know that. You're in theta or delta, which is great because you're at least in alpha. Remember, alpha is the lightest state of hypnosis, then theta or delta. So if you are unconscious, you are in theta or delta, which is not necessary, Ida, but it's great because then we know you're completely checked out and you're not analyzing anything. And the second one was, how long does that last? That answer would be multifactorial. That depends on you, how much sleep you've gotten, if you need to wake up and use the restroom. Depends on a lot of things. Ideally, it would last at least through the recording. My recordings are designed to help you go all through the night. asleep. So once you're in hypnosis and therefore asleep, I want you to stay in hypnosis. I remember a question I got earlier on. Ian asked early on, am I going to be doing any mastermind offerings? Am I going to offer any intense programs, mastermind programs? That was my understanding of it. And the answer is yes, we are working on that. So we're working on some Facebook groups, or at least one Facebook group where it'll be more exclusive, so you can get in and really take this up a notch. So look for that. Thanks for that question, Ian. I just remembered. Let's see. Who else do we have here? We have some other questions. We have a question about toxic relationships. I do have a recording for that. Of course, check out the resource hypnosisbystevegjones.com, and you will find recordings for how to strengthen yourself and remove yourself from toxic situations. I have a couple recordings. One is called No More Mr. Nice Guy. That's for guys who tend to be, a little too nice, bending and being taken advantage of. And I have one for women called No More Miss Doormat. Same concept. It's just one's for males and one's for females. So designed to help you boost your confidence. And again, we're working on ourselves. That's the person we want to focus on in life. We want to focus on working on ourselves. And I heard a great quote from somebody one time. It says, if you're a sensitive person, you can either carpet the entire world. You can put soft, plush carpet over the entire world so that anywhere you walk, it's going to be comfortable. Think about that, though. There's not enough carpet to carpet the entire world. So you can do that. You can work on carpeting the entire world, which some people seem to be focused on doing. Or you can put on some comfortable slippers. And everywhere you go, it's going to be comfortable. So we always work on ourselves. So thank you for that question. And Christian, you're very welcome for the answer. And I hope you enjoy your weekend too, Christine. And Norma says, I always fall asleep with the recordings every night. Excellent. That is, as I pointed out, absolutely fine because you're still in hypnosis. So we're going to wrap up here. I'll take one final question about deepenings. And Harusia, hello from Brazil. Congratulations on the hosting the Summer Olympics. And good stuff happening for Brazil. Aliska, hello to you. And Jeff has a question about inductions, which we talked about last time, but let's go ahead and take that because inductions flow right into deepenings. So in rapid induction hypnosis, you talk about between the conscious and the unconscious, there is RAS, and I believe you're talking about the reticular activating system, Jeff. How does this apply to deepenings? Okay, so it is a question about deepenings. At deepenings, have we gone past the RAS, the reticular activating system? Well, the reticular activating system helps us kind of empathize with what's going on with other people. And so if we are given suggestions that help us understand what's going on with somebody, that can kick in. But in the deepenings, yes, to keep this simple, Jeff, let's say that we are past the RAS and we're just focusing on deepening hypnosis. And that question actually the answer gets a little bit more complicated. One of the reasons, Jeff, why we are forming a mastermind group for people like yourself, Jeff, who do want to learn more and go into more depth. Let's take one final question beyond that as I'll take a more straightforward question, but thank you for that, Jeff. I think that's wonderful. Yasmin, thank you. You're very welcome. All right. Let's see if there's a final question, or I'm going to answer it before I wrap up. And if you're just joining, go ahead and subscribe to this. You'll know when I'm on next. This is something that's of no charge. You might as well learn something free. And go ahead and like this and share it. And Ida, you are very welcome. Liska says, good night. I do have a question that came in by email, which is how long should a deepening be? So we'll end on that. How long should a deepening be? And a deepening doesn't need to be any length in particular. And Keith, I see your question too. What is the benefit to deepening? The deepening intensifies the induction and makes sure that they are in a state of hypnosis. So we're intensifying that and ensuring it. So the question that came in was how long should a deepening be? Now, I always deal in relative time rather than saying a deepening is always 5 minutes or always 10 minutes. It should be based on how long everything else is. So, for example, if you do a 20-minute induction, which would be a fairly long induction, for an office setting, it would be appropriate. But if we do a 20-minute induction, then I would say about a quarter of that could be the deepening. We could do about a 5-minute deepening. Now, sometimes when I'm being interviewed, they ask me to do a hypnosis session. They give me 15 minutes. I mentioned that when I was talking about inductions. They give me 15 minutes to do the whole thing. So obviously I don't want to spend 5 minutes on the deepening because the deepening is just one of 5 parts and I want to get to the script. So I'm going to make it about 25% of the time that I took for the induction. And realistically, I don't count it. I just know, I just kind of feel it out, and I know that because I've been doing this for over 30 years, so for me it just kind of flows. But I would say, if I had to give it a time, I would say I would express that time as a percentage, and it's approximately 25% of the time of the induction. All right, so now you know about deepenings. I want to encourage you to check out the resources that I have concerning this if you want to learn more. Of course, there's hypnosiscertified.com. If you want to go further and become certified in hypnosis, go ahead and check that out. We also have an advanced class. We also have Ericksonian hypnosis. We have a few different options that you can take advantage of at hypnosiscertified.com. For those of you who just want it done for you, I understand. I'm the same way. When someone's telling me about something, that's nice. It's interesting to learn, but really I would just like to have an expert do it for me. So if you want me to do it for you, just go to hypnosisbystevegjones.com. There you'll find a resource with a lot of hypnosis recordings, no planning or learning involved. All you do is download it immediately and you can listen to it. And we're talking about topics such as confidence, motivation, weight loss, stopping smoking, sleep, things that are being mentioned here. So it's a very helpful resource. Again, the 2 resources I mentioned today are Hypnosis Certified and hypnosisbystevegjones.com. And on that note, I'm going to wrap up. Thank you all so much for your questions. You make this possible. And remember, if you haven't already, go ahead and subscribe so you get notifications. Go ahead and like this video. Go ahead and share it. You may have done that before, but this is a new video. So go ahead and like it and share it. Let your friends know what's going on. Let your friends know there's a valuable free resource out there, which is me. I'm available 3 days a week. Monday, Wednesday, and Friday I'm doing these. So I hope you have a great weekend. I will look forward to talking to you Monday. I'm Dr. Steve G. Jones, clinical hypnotherapist, hoping you have an outstanding day.